Hey Crowns, I'm Aaron Gannier, a practice advisor for Total Patient Service Institute, and I'm here with Dr. Michael Hoffman and part of his team here in St. Louis, Missouri, and we're here to find out what they do in their office, and maybe you can learn something from them and make your practice better.
Hi Crowns, welcome to the Dental Anesthesia Center here in St. Louis, Missouri. I'm Dr. Michael Hoffman. Our practice is a general dentistry practice, but that provides anesthesia services for patients who are unable to get dental care otherwise. I'm a general dentist, member of the Academy of General Dentistry. I'm a fellow of the Academy of General Dentistry, but also I'm a board certified dental anesthesiologist. I work as an operator anesthetist. I completed a 2-year residency in dental anesthesiology after dental school in addition to a GPR. And I'm a diplomat of the American Dental Board of Anesthesiology and the National Dental Board of Anesthesiology. So come on and we'll show you our practice and show you what we do here.
Hi, I'm Mary Lee and I am with the Dental Anesthesia Center. I'm here to tell you a little bit about our practice. Our practice is a little bit different than the average dental practice. Dr. Hoffman is a general dentist who's board certified in dental anesthesia. So we see a broad spectrum of patients here, patients with very special needs. They're very medically compromised. We do patients who have cerebral palsy, autism, Down syndrome, extreme gaggers, patients allergic to local anesthetic, patients who are very, very phobic. It's a very rewarding practice because we really get the enthusiasm from the patients' families who appreciate us so much for being able to find care here where they would not find care anywhere else for their loved ones.
One thing I like to talk about is how I go about selecting employees, especially anesthesia assistants. I'm really looking for assistants that can have a good focus on the anesthesia, on the patient, and maintain that focus. And I found that assistants with an S personality are really adaptable at doing that. They very caring for the patient. They don't get distracted very easily, and they're really a joy to work with, and they work well together. So I really like the S personality type for my anesthesia assistants. But you know, when it comes to ordering things like that, I like C personality types, and for my front desk people, I like a little more of a DC personality type. So we use the disc every day, not only with patients, but also with our employees as well.
Hi Crowns, I'm here with Mary, the office manager at Dr. Michael Hoffman's office, the Dental Anesthesia Center, and we wanted to talk to Mary and ask her maybe a couple questions. So tell me and tell the Crowns maybe a challenge that you've come across over the 15 years that you've been here and how you've overcome that challenge.
Well, one of the challenges that we experience, and I know all of you have experienced it too through the Crown Council, the economy. And the type of patients and treatment plans we see here, they're very large treatment plans. A lot of dentistry, they're upwards from $10,000 to $40,000, and those are not inflated fees. The care is based on patients who haven't had care in 15, 20, 25 years, some of them a lifetime. And I think if you create the value with the patient or the patient's family and educate them and get on their level and use your picture words, they understand the need for it, they want it, and the reward to that challenge is that they are so grateful and appreciative of the good care that you have given them or a family member.
Excellent, excellent. Well, you heard it here, Crowns. Find what matters most to the patient and speak to that patient so that you can close more cases. Thank you so much, Mary. Appreciate that.
You're welcome, Aaron.
Mary, can you talk to us about leadership and systems and having a happy dental home?
I can. Crowns, I wanted to step away from patient care a little bit and give you a little pearl that has worked well for us, and that is in regards to practice management. It is extremely important that you have your systems in place and that you revisit those systems, and you may have to tweak them every once in a while. The other thing is doctors. You need to keep your team highly educated. You need to be inspiring, and team members, be enthusiastic about what you do and who you're doing it for. You're not just doing it for yourself, you're doing it for your patient, you're doing it for your own family. That in itself creates a career that you should enjoy, going to work every day and coming home and feeling rewarded. So good practice management includes good leadership, and I've always said behind every good doctor there's a good team.
My name is Robin. I work for the Dental Anesthesia Center with Dr. Michael Hoffman as an assistant. I've been here for about 3 years. One of the things that our doctor does for us, because he believes in a happy team, is stock the refrigerator. I personally am a big fan of this, as I am a very big fan of food. We're not talking just snacks. There are times that if I have time, I can prepare people a full course lunch meal with what we have in the fridge. A happy tummy makes a happy team, and I suggest that all you doctors do the same.
In our office, we go through regular training for anesthesia emergencies. We go every month and either do a lecture or some type of hands-on work in the office that we work with medical emergencies, anesthesia emergencies. All my assistants have gone through the Dental Anesthesia Assistant National Certification Examination. Also, we put all our assistants through ACLS, and currently some of them are going through PALS. We find this very important. Not that any of these assistants will probably be doing this on their own, but it makes them more capable of helping me in an emergency, and that's the important thing, is that you want as many hands-on with the patient as possible. You have all these assistants be able to assist you in emergency, and you don't have to continually delegate to them what to do. They are there with the materials as you need them. They're preparing things and looking ahead and seeing what you're going to need in the far chance that you may have an emergency. So I highly recommend that if you haven't been doing emergency training, that you continue to do emergency training in your practice, and do it on a regular basis, at least once a month. Work with your staff on medical emergencies.